3-minute when should I consider surgery for carpal tunnel syndrome video. I'm Dr. David Warwick, author of Back and Neck Pain, a relief book, short-term care for your neck and back pain, and not one single visit more. Carpal tunnel syndrome affects about 3% of the population in the United States. It's a nerve or an entrapment neuropathy. Pinching nerves that occur in the arms or legs is what entrapment neuropathy is. Managing carpal tunnel syndrome depends on an accurate diagnosis. So when should we consider or surgery be considered? First of all, there's a lot of complicating or other factors to be considered. For example, rheumatoid arthritis, diabetes, obesity, thyroid dysfunction, fractures, things of that nature. But it's important for the doctor, importantly, to check the median nerve, starting from the neck all the way down to the wrist. So when should a non-surgical approach be used? Almost always. That is the best course of action, except when it's been acute, resulting usually from a wrist type fracture, compression, or some type of bleeding, or something that requires emergency surgery. More commonly, it's better not to have surgery at the beginning, and especially the American Academy of Orthopedic Surgeons recommend, their primary recommendations are to use a wrist cock-up splint, steroid injections, and ultrasound. All those can be a consideration when working with carpal tunnel syndrome before you start doing surgery, especially considering a 4 to 6 week trial, and even a little bit longer if you're responding and satisfied with the non-surgical approach. So conservative treatment can include physical therapy, bracing, steroid injection, alternative medicine such as chiropractic. This is where we work with working with the tendons, gliding in the nerve compression and gliding in there. You can incorporate exercise, yoga, acupuncture, and including laser treatment. Some of these things under chiropractic management are often done with bracing, manipulation, some types of mobilization, exercise, even talking about nutrition and ergonomics. So obviously your doctor of chiropractic understands some of the limitation and approaches and understands when it's time to use conservative versus a non-traditional or non-surgical approach. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. Look at my blog at drdavidwarwick.com. Thank you for watching, and look for my next video.